When we eat more calories than we expend, the body stores the excess as fat. But fat tissue is not only storage depot. It produces a number of substances that affect other tissues, often in a negative way. Therefore, if we have too much fat tissue, we get sick. Diabetes, cardiovascular disease, and cancer. If a person has so much body fat that the risk of these disorders is increased, we call that person obese. However, we know that not all obese people get sick, fortunately. And why some obese people do get sick and others do not, we actually do not exactly know. We know that genes play a role, but lifestyle factors are also very important. Healthy nutrition and regular exercise clearly prevent chronic disease in obese individuals.
Now, genes are very important, but maybe even more important are the factors which switch genes on or off, the lifestyle. And we want to measure the metabolome to investigate the influence of the lifestyle on someone's health. So what we want to do is to understand the system changes associated with the onset of diabetes, but also the system changes, let's say, upon caloric restriction when diabetes is reversed. And how we want to do that, I will just indicate here. If we have here a time axis, and here we say whether someone is healthy or diseased. If someone is healthy, we cope with a lot of challenges, but still we remain healthy. We can have enough metabolic flexibility, and at a certain moment, for example, we get obese, but we can also stay still healthy without getting diabetes, or we develop diabetes. And what we want to understand is what happens, why do certain people develop diabetes and others not? And we want to find for that the proper biomarkers. Now, currently, glucose is measured in blood or other, let's say, biomarkers, but we are convinced that by measuring hundreds or thousands of metabolites with use methods like LCMS, we much better can predict this kind of developments. And we are convinced that these biomarkers will help to support clinicians to give a much better personalized advice what people should do. And ultimately, also the general practitioner will be able, by just using a droplet of blood, to predict whether his patients will become diabetes and what they have to do to prevent that.
In collaboration with the NMC, we examine the systems changes that are associated with obesity and the powerful effects of calorie restriction on these changes. We try to gain better understanding of why some obese people get sick and others do not, and also how calorie restriction exerts its health benefits. The ultimate aim is to identify obese people at risk for disease and to design a treatment that mimics the effects of calorie restriction. Thanks to novel metabolomics technology, we can better understand the complexity of our body and design the most effective treatments for our patients.